Hi, I'm Dr. Carol Petherbridge, and I'm a naturopathic physician here in Bend, Oregon. And I am a women's urinary incontinence and sexual wellness specialist. And in January, on the 24th this year, I had a women's intimate health support circle. And we had so much fun, we didn't get to all of our question and answer process with our panelists. So today I have one of our esteemed panelists, Jessica Carlton, licensed acupuncturist, and we are going to chat today a little bit about the multiple hats that you wear, Jessica, or as you put it, the multiple lenses that you use to look at the clients, patients, people that come in contact with you. So tell us a little bit about yourself.
So I began my journey as a practitioner as a licensed acupuncturist. And, while I was in acupuncture school, I also developed a huge love for sound healing. So that became incorporated into basically every aspect of my practice. I also became a Taoist face reader with Lillian Bridges and studied with her. I studied with Master Lue He, and she is my Qigong instructor. And so I became a certified Thousand Hands Buddha Qigong teacher.
1,000 hands Buddha Qigong teacher. Okay, say that fast a number of times. So face reading, Qigong. Wow, that's fascinating.
Yeah, still going.
Okay, keep going. Didn't mean to interrupt you.
Yeah. Oh, I don't feel interrupted. No, I also do subconscious mindset coaching. So that's NLP, that's hypnosis, it's time techniques, it's emotional freedom techniques or tapping is another way that people are familiar with that practice. I also do a lot of human design guidance. That's kind of the first lens that I look at everyone through. And I do intuitive reading as well.
Awesome. So, well, I remember
Dutch apothecary, so I do herbalism also.
Okay. Well, you and I had the great pleasure of having coffee together, and I think we spent about 2.5 hours with you talking about my human design. It was really fascinating. So I love that approach and that aspect that you bring to your work. So what I've been asking my other panelists in these interviews is to get a flavor of what is it like to work with you. So maybe share with us what the process is. You're not in a quote brick and mortar type of practice at the moment, but you have all these amazing offerings. So how are people able to engage and work with you?
Yeah, I made the decision this past year to kind of step away from the traditional framework of a practice and work more in sort of long-term transformational containers with people. I found that that was the work that nourished me the most, and also the way that I can be most effective in working and helping others. I definitely I work a little bit differently with everyone, to be honest. It's like a unique path that I kind of co-create with the person that I'm working with. And so typically what that looks like is we start by taking a look at their human design. I want to know what their sort of energetic blueprint, sort of the way that they're designed to move through the world. I want to know what that looks like. And I also want to know the ways in which they have been conditioned by the other into how they should be moving through the world, because that may or may not be correct for them. And then once we kind of go through that, I also want to take a look at, their full health story. And so that typically looks like a virtual consultation. And there I want to not just hear their history and sort of what the Western lens looks like, but I also want to hold space for their experience moving through the Western medical health system and sort of their relationship to disease or dis-ease. how they identify with whatever conditions they may have or would like to work through. I want to know, how they're moving through the world currently and how they'd like to move through the world and how we can make that align with how they're designed to move through the world. And so it looks like a lot of just really one-on-one personal time in the beginning. I also like to look at people through a face reading lens, which gives me not just information about your shen and your spirit, but it also gives me information, about your chi and the state and health of your vitality and your organs. It gives me information on your jing and the way that you've been impacted through different ages and stages and phases of your life, things that may have happened at different points in life. I want to look at how all of that impacts how you move through the world and how you see yourself. And so, it's a slow unfolding working with me. We kind of peel back layers, and some of that mostly looks like virtual work. If you're located here in Bend, then we can meet in person as well. I don't hold an office space currently, but I have plenty of spaces that we can meet. And I want to look at you through those lenses before I even touch acupuncture or touch subconscious coaching, because with subconscious mindset coaching, if we are conditioned to think there's a way that we should be that isn't correct for us, what damage am I doing by working on like an identity level with you, changing your subconscious mindset approach to the way that you move through the world if that isn't correct for your design, right? So I want to make sure that that feels ethical as well. And sometimes that takes some deconditioning first. And so the length of that process looks a little different for everyone. I don't typically do one-off sessions. I like to work more in a container because I feel like, there's just so much to take a look at, and it takes time. So
I love your curiosity and the depth of what you're talking about. And again, at our coffee meeting, you were talking about different aspects of the face and how different lines and places relate to a certain age or event. So it's really fascinating, the information you bring, and I really appreciate that, taking the time to do a deep dive, which I've always done as a naturopath too. We're in similar mindset in that the more we get information to really understand a whole person's being, then the better we can really work with those underlying issues and situations and make those deep lasting changes. So that's really powerful. So at the event, you shared very deeply about your personal experience with some health challenges you had, and then how that relates to making choices and decisions about how you practice. And just some feedback, I had a few women say, wow, I was just moved to tears by Jess's share. So I think you touched a lot of women with your vulnerability and your authenticity and the rawness of what you brought to that event. So I wanted to thank you for that. The more we learn to share that way with each other, I think the easier it is to be more authentic and seen in a bigger context, and not just everything's fine and I'm great and my life is perfect on the outside when maybe we're crumbling on the inside. So you really were a great role model for how to walk and share that full integration. So I wanted to thank you for that. So during the event, sorry, I want to let you respond to that.
Oh, I was just saying thank you so much. That's very, it means a lot.
So during the event, there were a few questions that were brought that we didn't have a chance to chat with, but you and I shared before we started the call about wanting to go to one of our previous circles where the topic of libido was the question or question and answer. And so you had some comments and things you wanted to share in relation to that. And I'm sure all of our listeners can in some way relate to or are maybe a little curious about the topic of libido, and whether we're sexually active in the moment or not, it's still an interesting process that we address as women. So what did you want to share about libido?
I mean, really our libido can be impacted by so many different facets of our life, right? So it's not just about energy levels. From a Chinese medicine perspective, we're going to want to talk to you about the state of your kidneys, energetically and physically. We're going to want to talk to you about your essence and your Jing, and all of that is important. And there can definitely be a lot of health reasons why we can be experiencing low libido, whether that be different medications, different like yin or yang deficiencies or essence deficiencies within the body. But also, I think more often than not, it's typically not always our health that's impacted.
Yeah.
Let's be honest. I mean, it definitely can be, and it definitely can be that we're tired and we live in a society that, thrives off of capitalism and off of pushing ourselves beyond our limits. Because if we're not constantly, striving and achieving and pushing ourselves, then we're not a successful human, right? And then we, go into spirals of shame or guilt. Um, and so, yes, like stress levels and society and our health all come into play. But most importantly, I think often too, what comes into play is our relationship with ourselves,
Mm.
where we are sitting with our self love, where we're sitting with our comfortability with our sexuality and with our bodies. A lot of times, our insecurities, and human design, even through that lens, there can be aspects of your design that impact your sexuality. For example, do you have a defined sacral or do you have an undefined sacral, right? Like a sacral center is responsible for our sexual energy, for our creativity. And so someone with a defined sacral is going to have more consistent access to sexual energy. Someone with an undefined sacral may ebb and flow, but they also can amplify the energy of those around them, right? And so
Yeah.
that makes a difference. Our gates and channels in human design can make a huge
Mm.
on our libido. Like, for example, if someone has gate 6 in human design, gate 6 is highly connected to a fear of intimacy, and so they have the other gate on the other end of that, which I believe is gate 59. That gate is like the gate that is responsible for helping us to be more honest and vulnerable and intimate in our partnerships, right? And so, having one aspect of that defined and the other aspect undefined, or maybe you have the full channel, but you're sitting in your shadow aspect of that gate and not, in what the gifts are of that gate. And so all of that can impact you as well. And so I just think that there's so many different ways that we should view that lens. And there's a lot of different methods for support. I mean, definitely changing your relationship with yourself, changing your relationship with your partner. Do you have a partner you feel safe to be intimate with? Do you feel like you can be honest with your partner about your sexual desires? That can be a huge part of intimacy.
Right.
Are you in conflict with your partner? Because conflict avoidance of conflict is one of the fastest ways to have an intimacy block in your relationship.
Yes.
I think that it's more than just one thing, right? And so I
Yeah.
think it requires us taking an honest look at ourselves, our relationships, how we interact with our careers and our personal lives. Like it's all the pieces, really.
Well, I'm chuckling along with you just because the some of the aspects of what you're talking about I've seen at different phases of my life, the avoidant and the uh, anytime there's conflict or and that's the beauty also of libido is there can be many things that excite and initiate and turn on our libido that we
Totally.
may or may not be aware of until suddenly it's happening, or even smells, taste, touch, sight, sound, any of the senses can trigger that. There's different styles of intimacy too. There are people that are what we call more of a reactive libido, where they need someone to initiate and then they respond.
Mhm.
Or maybe there's that more spontaneous person that's just seems like they're always ready. And if you're more of a responsive person, then you're wondering, well, why is my partner like always on? And it takes me, a bit to getting into the rhythm. Or and like you say, there's so many resources and ways to approach this. So I love just opening up this conversation about other ways. Um, from the lens of Chinese medicine, from the lens of just energy and channels and human design, and all the way to my realm of where I'm looking at, does a woman have good tissue integrity so that it's uncomfortable? I mean, that it is comfortable to have intimacy, and if it's uncomfortable, that creates a lot of fear and avoidance, and pain is not generally something that increases libido. So um,
And I feel like you can be honest with your partner about the pain and discomfort that you're experiencing, because
yeah.
I've with so many women who are silent. They're embarrassed by it, or they don't want to turn off their partner, or they don't want to be the burden in the relationship. I mean, there are so many ways we internalize different guilt and shame and
Yeah.
the fear of speaking our truth with our partners. And all of that really can impact our sexual relationships.
Yeah. Well, great conversation. I love that. Um, there's a couple other questions that I've also reviewed with some of the panelists, but I'm really excited to have your input as well. One of the women asked if there is a way to stimulate the breasts after a double mastectomy, and meaning that once you've had your breast tissue removed, and maybe there's been implants or maybe not, and there's often scar tissue, and there's with breast cancer, there could be treatments such as radiation and chemotherapy, or uh, hormone reducing medications that really drop women into this very severe hormone deficiency stage, which impacts their quality of life in so many ways. So you might have a few thoughts on that. You thought you wanted to share?
Yeah, I mean, I think that there are a lot of really helpful methods, especially with Chinese medicine, to approach bringing sensitivity back to the breast. There's definitely acupuncture threading that you can do, especially with scarring. A lot of times,
Yeah,
scar builds up, and that prevents sensitivity as well.
right.
Um, I also know that there have been plenty of studies to show that it helps with the regrowth of nerve
Mm,
um, too. And so, I think that acupuncture combined with electro or e-stem can be really helpful for that. I think moxa or mugwort, burning mugwort, can be a really helpful tool, not only for reducing scar tissue, but for just promoting regeneration of health and tissue in that area in general. There have been studies that show that burning mugwort over the skin or directly on the skin can actually reach all the way to the red blood cells in the bone marrow and stimulate, reproduction of those to promote healing. And so um, I think that that can be a really helpful approach. Definitely utilizing herbs. I want to make sure that there's good chi flow to that area and good blood flow to that area. Um, I think that
I'm thinking there's oils and topical things that can be used. I've been using like an emu oil combination for women on their vulva and their vaginal tissue for repair and regeneration. Of course, emu oil is amazing for scar tissue. So I'm sure in Chinese medicine, there's so many wonderful topical products that can be used to stimulate tissue function. and sensation and pain and inflammation.
And then for me too, I'm always working and looking through the lens of like energetic and spiritual health as well, right? And so
Right.
what is her relationship to that double mastectomy? Is
Yeah.
she feeling insecure or self-conscious around her partner? Is she feeling that personally? Because I think that also that can impact, I mean, there's plenty of studies that show the psycho-emotional impacts of like holding things, right?
Yeah.
And can impact our health and our body tissue as well. So
Yeah. Wow. I had an interesting conversation today with a woman who locally is involved with the Breast Implant Safety Alliance, and just talking about breast implants and the issues that come up with that, and just like the conversation started here, but then we also dive into, well, what is it about women and in society that have them in that position where they feel self-conscious about their appearance in many different circumstances. Either they want breast reduction surgery, or they want a breast implant to augment their breasts, or uh, we could dive into all those other areas. But then what are the health consequences that come from doing these procedures? And there's such a huge industry, well, multiple industries that want to sell us implants and medications and clothing, and on it goes. So there's just a lot of pressure on women to have certain body images. And, for example, after a mastectomy, uh, just having no implants, and what is that like to be a woman in the world in that way? And just different organizations that are out there starting to show that, okay, we I guess there's an organization in LA that does an event where the women that have had mastectomies walk down the street without their shirt on, showing their scars and their flat chest. And there's a lot of opportunity for us to take back and normalize and empower ourselves around our body images, our messaging from all these other sources. And does that align with what's within? And that, I think, is what's so beautiful about your message, is you have all these beautiful practices to help women and men find those internal messages, those internal voices, and how then do we want to express those outward. So I'm excited for what you offer.
I mean, so much of it again just goes back to conditioning, right? Like conditioning from society, conditioning from relationships with other, the conditioning that we do to ourselves.
Yes,
This is often the
been
worst.
there, done that, right?
Conditioning, let's be real, right? Like
Yes.
all of those things impact the way that we move through the world, the way we find our value in the world, the way that we're told whether we're valuable or not, or what we should or should not do. And I think that that's why I love human design and face reading so much, because really it's the bottom line of that practice, or both of those practices, is their tools in which to look through a lens of being able to honor the most sort of authentic expression of yourself, and to fall in love with that person, and so forget the conditioning, forget what you've been told by the other, forget how you feel like you should move through the world. Those practices have given me so much self-acceptance, and I've seen them transform the way other people view themselves, and also view their relationships, and how they move through the world. And, you'd be amazed how much your health improves just by aligning your spirit and aligning your energy with what is correct for you, and how much
Just hearing you say that, I like, it's like I want to take a deep breath and dive into that. Yeah.
and how much dis-ease comes from, and resistance comes from stagnation and from the participation in things that aren't correct for us because we feel obligated to it, or we feel like that's how we should be or should move, right?
Yeah. Awesome. Well, a couple more questions. One was about addressing hot flashes and night sweats around menopause. Just menopause itself is a very big topic, and Chinese medicine is a wonderful therapy for helping women through hormonal transitions, heading into beginning your menstrual cycle, dealing with your menstrual cycle as your menstrual cycle ends, around pregnancy. So let's just shine the lens a little bit on menopause and just any wisdom or thoughts you would like to share around that topic.
Yeah, I mean, I think Chinese medicine is probably one of the most beneficial sort of therapeutics or support for women and menopause, and not just through the use of acupuncture, but also through the use of super powerful herbs. A lot of it has to do with our kidneys. From a Chinese medicine lens, they are sort of our source of energy, the yin and the yang. They are the source of our Jing and our essence.
So kidneys are really, like, would you say almost like the foundational piece? The kidney energy is really like sort of that first piece you look at in a person's energy and well-being. Is it that crucial?
I mean, it's definitely one of the most.
Okay.
Like from a perspective of women's health, I typically don't just want to look at the kidneys. I also want to look at the liver, the spleen. I think that there are bigger pieces there, but I do think the kidneys are a very large foundational piece of that. It's typically kidney yin deficiency or kidney essence deficiency that's responsible for a lot of night sweats. If you take in the morning, it can be a yang deficiency issue. There's many different patterns, and that's what I love about the personalization of Chinese medicine, right? Because literally we're looking at your body like an ecosystem. We're not, I don't care what you've been diagnosed with, to be quite honest. It's not that I don't like right. That is the lens I'm looking at you, not a Western medical lens that's put you in the box of this condition that you've been diagnosed with that's really just a set of symptoms or presentations. It's sort of very linear,
right?
And it doesn't look at the body as a whole or the spirit. And so, that's why I think really looking at the body like an ecosystem, and you want to balance it like weather patterns. I mean, we're very much like nature in that regard. And so a lot of it is just rebalancing, and rebalancing allows the energy to flow smoothly, the blood to flow smoothly, the chi to flow smoothly. Sometimes, with age, we also need to make sure we're nourishing ourselves, right? And getting the body as well, and protecting and preserving our energy and our health. And
I think that's a great point. We have this term or this diagnosis, if you will, menopause, meaning our menstrual periods are coming to an end. So our hormones are shifting. But from your perspective or Chinese medicine, it reminds me of say in native cultures, there's the native Alaskans, there's like 20, 30 different words for snow, for all the different kinds of snow, right? So we have menopause, but then there's like the yin deficient or the yang excess or the liver stagnation. There's all the different ways that can show up. So menopause is just a very big umbrella, and each woman comes to that in a different state of health and goes through it in different states of health and different circumstances. So that makes a lot of sense to follow really where they're at. And a lot of what you're talking about is meeting the person where they're at and then helping them move in their journey with more balance and support and nourishment and ease and all those wonderful things that make us feel good.
And really moving from a place of personal empowerment too, right? Because,
Yeah.
I mean, my goal and working with people over that length of time, however we set our contain, however long our container is, right? Because that process that can change.
Yeah.
But my goal is to give people tools to empower themselves, right? To be able to not need me very right,
Yeah.
like only need
Right.
to see for that tune up, right? To be able to not feel overwhelmed by things that come up with their health, and to have some just remedies and tools that are maybe outside of the box, to be able to have at their disposal for support, because we could all use a little more support right now. And let's be honest, the Western medical healthcare system is pretty broken.
Yeah.
It's very rare that people get to feel fully seen and heard by their medical provider.
That is very true. That's a whole other topic.
Yeah, we could have a
Um,
whole day talking about that
we
one.
could spend the day, yeah. And well, the last question I wanted to run by you was, and I think this is really common again, especially in the menopausal realm, but younger women who've had either early hysterectomies or hormonal imbalance or other situations struggle also with vaginal tissue changes, tearing, bleeding, pain with intercourse, chafing, all the way to being, affected by, say, lichen sclerosis, which is a dermatologic, it's a condition of the skin or the tissues of the vulva, which is very destructive and causes a lot of pain and itching and scar tissue. So let's talk a little bit about tissue integrity and pain and sex and lube and how that all fits together from your perspective. It'll tie back to the libido that we started with.
I mean, and again, it's so many different facets, right? I personally suffered for a while with lichen sclerosis myself. It's a condition that there aren't a lot of good Western medical therapeutics. I think
Well, basically, steroid cream is the
what you
standard
do
of
is,
care.
yeah, exactly. And then what you do is now also, I think, a really viable option from a Western medical approach, and probably a better
Yeah.
one than
Yeah.
steroid creams, because we all know the health complications that can arise from continuous use of steroid creams. Personally, I could not use steroid creams. They weren't an option for me. I tried and immediately got eczema for the first time in my life.
Oh, wow. So eczema and
Wild,
lichen sclerosis. I'm so
right?
sorry.
Right.
Wow. Yeah.
And then there are all of these sort of emotional things that come with that as well. And you feel embarrassed, you feel frustrated, it's uncomfortable, it is painful, and
Yeah.
it's frustrating, and it makes you fearful of sex or fearful of any sort of
Even physical
abrasive
activity too, just exercising and
exercising,
riding a
sweating,
bicycle.
underwear you choose, like all of those things become really like very important. It's like no more sexy panties, like cotton only here, thanks. Like, I mean, for the most part, and so there's
Right.
just a lot of things that come into play. And I think that there are a lot of options that women just don't know about, and it's not something that's
Yeah.
often talked about. I myself am not in menopause. I think there was a huge psycho-emotional component to me. Lichen sclerosis, I happened to be in a relationship at that time where I was in a lot of conflict with my partner. And there have been many studies that have tied fibroids, tissue changes, cysts, interstitial cystitis, a lot of different vaginal sort of women's reproductive health issues can arise from having conflict in your relationships, and that's not something that's often talked about. And for me,
Well,
that was the only explanation they could find. My hormones looked fine. I am a fully menstruating human. I have not really had much as far as any sort of like I've never had an abnormal pap smear. I've never had a history of like yeast infections or UTIs. So for me, it was kind of shocking. It was like aware. Um,
Right.
was really, yeah, really uncomfortable. The things I did find that were really helpful for me, definitely changing the kind of underwear that I wore was really helpful. I also do think there could have been an association to using, I do a lot of baths. And so I was definitely using Epsom salts that had fragrance.
Oh, okay.
I mean, that really inspired me and my small batch apothecary to create a line of bath salts that I use only flower petals in and no fragrance at all,
Okay.
because I do think that we're sensitive there. And so it's not really great, even if it's essential oils or even if it's not artificial perfumes, like all sorts of things can create sensitivity problems there. And so I think that was like a piece for me. I think I used definitely some rose hip oil with vitamin E. That was helpful. I used CBD topical applications that were helpful for pain and itching.
Right. It sounds like you used those things that were very supportive and nourishing to the skin or the tissue, the outer tissue, which those I use calendula, I use CBD oil, I use emu oil, I use
Great.
sometimes topical hormone creams to really strengthen the integrity of that tissue as well. Because when our hormone levels decrease, the integrity of our tissue can be affected by our hormone levels too. So, yeah, lots of opportunities.
Are really great. Vaginal steaming is really great as well.
What was the thing you said before vaginal steaming?
Sitz baths.
Oh, sitz
Herbal
baths,
sitz.
yes,
Yeah.
without the fragrance, yes.
Without the fragrance, I utilize
Gotcha.
these herbs mixed with some
Yeah,
Epsom salt as well. And those are really helpful. I mean, those are not just helpful for tissue changes, they can also be helpful, you know, after giving birth. And
right.
so, yeah,
Well,
there's really wonderful things that you can do. But I do think too, it's worth also examining the energetic and spiritual component of your relationship.
well said. Very well said. Well, Jess, it's so delightful to share all your tidbits and information. I'm sure that as women listen to this follow up, they're going to be really excited about some of the real actionable pieces that you've given here. Is there anything else you'd like to share as we wrap up?
Goodness.
We've
I mean,
opened a big,
yeah, I
beautiful
feel like you and I
basket
could
of
really talk
opportunity
for
here.
hours, honestly. I definitely will be launching my small batch apothecary in an online forum very soon, probably within this next week. I've been selling in the community and to patients and friends and colleagues for a long time, but I'm finally going to put them online. So that's something to look forward to. And then I am going to do also an event in the community. One of the ways to work with me outside of a one-on-one container is through community events. And so I'm going to be hosting one on March 19th at Breathe Love Bend. It'll be in celebration of the spring equinox.
Okay. I'll put that link on the email with this recording too, so women can find you for that event. That sounds great.
And then I am also available for private events. So you can always talk to me about those.
Okay. Well, such a delight to spend this time with you. Thank you so much for your beautiful healing essence, your big heart, and all that you offer in this community. I really feel blessed to know you and to be working side by side with you.
Well, thank you so much. Thank you for having me. And I just am so appreciative of the ways in which you bring us all together in this community. We're so grateful and just lucky to have you.
Oh, thank you.
Yeah.
Thanks. All right. Well, take care and stay tuned, right?
Yeah.
Keep an eye out for Jess in the community.
Yeah. to do this again sometime. It was fun.
Thanks, Jess. Bye now.
Bye.